pain management, UTI, and migraines. Oh my. Let's talk pain management. Okay, and I'm gonna get ready for bed while we talk about pain management. Let me get a wash rag, hold on. Because I already showered earlier and washed my hair. So this is the easy part. Okay, pain management. I have never been to pain management before, even with all of my chronic illnesses. I think the hope was to really figure out what was going on, which we have, and then fix them. Okay, yeah, naive and whatnot, but you know, if it's poop, you gotta cover it in glitter. So I've never been. I've never really, I have sought help with pain. Like I'm doing the Botox for migraines, and I was on something called meloxicam or Mobic for a long time, 2 years, 3 years, I guess, to try to get me some kind of relief, like anti-inflammatory. It's equivalent to Motrin, like how much Motrin or ibuprofen or whatever that you can have, but it's only one pill, so it should be supposedly easier on your stomach. But we think that was making some of my GI stuff worse, so we actually stopped that a couple months ago maybe. It's just on hold at the moment. With the first tube surgery going so poorly, and so many side effects kicking in from the first tube surgery, and having such a hard time in the hospital getting anesthesiology / pain management to figure out what was going on. I mean, it was so bad. And so because of all the complications with the tube surgery, I was referred over to the head of pain management for my health system. So I had to wait 3 months for the appointment. Thought about quite a few times canceling the appointment. Mostly it was just because any respite that I had from the side effects, I really was like, oh my gosh, it's finally getting better. But just like everything else, it seems to be cyclical. Like it'll get a little bit better and then it's horrible, and then a little bit better and horrible. So anyways, with all the rest of the issues, muscle problems, joint subluxation, so my joints hurt all the time. Migraines are unreal. My migraines are worse now than I honestly can remember. And it's funny because I'm on my second round of Botox. I have my third one in maybe 3 weeks, I guess. So I'll go back and have the third round done in 3 weeks. And my migraines have been worse now than they literally have ever been. Like, I swear I'm on like day 800 of migraines. So going into pain management, the guy that I was meeting, so he's the head of the department. He's also one of the ones that came down in the hospital when I was in so much pain after this tube surgery. I was totally out of it at that point, so I don't remember meeting him at all. My mom does. And she said that he was very sympathetic, you know, patted her on the back, said all the right things, you know, well, you've got her taken care of, you know, we know what to do, you know, I won't let you down, you know, we'll definitely, you know, we've got it under control and whatnot, you know, and we're here for you and blah, blah, blah. And then, so that hospital stay was 5 or 6 days, and we never saw him again. Not once. I don't remember seeing anyone from pain management after I actually got moved to my GI floor. With how much pain I was in, it really shocked me that I didn't have somebody from pain management checking to make sure that it was okay, and that I was okay and settling in and whatnot. That was really frustrating. So that's my first real impression that I got from my pain management. Obviously not a glowing review. So with the complications not going away, I was referred to pain management to really see if we could get it taken care of. And so anyways, 3 months out. So yesterday was my appointment. And I tried to cut this video once and my card filled up like 20 seconds after I started, so I had to get it all off. Okay, so first impressions, not great. Second impression actually came from my GI when she heard who I was seeing. She said he was like an old school guy and kind of a bit of a curmudgeon, not a glowing review, and I didn't know exactly what to expect, especially with not having great expectations. And I still try not to have great expectations with appointments, especially with new doctor visits, because oh my gosh, it's literally like a grab bag. Like, it could be great or it could be horrible or it could be somewhere in between. So I had to go to one of the new facility to me. I'd never been there before. And I got into the appointment. I got there early. I filled out all my paperwork online, but I knew that they had something extra for me to fill out, which was that like double-sided human piece of paper, you know, and you have to circle everything that hurts. I literally wanted to just circle the whole body and say it hurts, like, because what I feel right now could be totally different than how I feel in 5 minutes, or 5 hours, or the next day. And so I had like 2 huge different sections of stuff to talk to him about. Obviously, I have all the side effects that I need to try to get under control, but then I have all the chronic pain issues as well, that I would love to have some help with. But I am so unwilling to take opioids of any kind, not because I'm against them, not because I think they're bad or anything like that, but they're so hard on my GI tract. Like, my biggest problem is I can't get my GI tract to move along like it's supposed to. It's super slow. And so with that dysmotility, taking anything that makes it slower, oh my gosh, is the death knell of any medication for me, because my GI symptoms are my worst thing. Okay, I'm gonna brush my teeth, and you guys are gonna watch it and fast forward, so hold on. Side note, I've had a bad tooth, second from the back on the right. I think it's number 30. I had problems with it growing up. I had filling after filling after filling, and then I had a root canal that failed, and then I had what's called an apicoectomy. So the root canal is done, your tooth and filling and whatever on top, so your jaw on the inside is cut open like on here, and it's cut open from all the way in the back to up front, and then there's a slit that's made down, so like my whole jaw was peeled open. And then the roots of the root canal are actually like backfilled to try to save the tooth. So that failed. So I ended up having to have the tooth taken out. Then I got a dry socket. For anyone that has ever had a dry socket, my heart bleeds for you. It's horrible pain. Like it was awful. And then I think 6 months later, something like that, I had an implant put in. So part of my jaw was taken out, and then it's like a post, like a metal post, and they literally like screw it into your jaw, and then the top of the implant comes to the surface of your gum line. And there's a little cap that gets screwed into place, and then that has to heal. I got a bioidentical implant, and so your bone like grows into the implant, which is really cool. Very, very sturdy. And then however long after that, then I had to get a crown, because they take off the cap, they screw a post in, and then you have all the impressions done and all that stuff. Temporary crown put on, and then a permanent crown was created. The company that did mine totally messed up my first crown. It was literally like half the height of what it was supposed to be. I have no idea how they messed it up so bad. And so I had to have a second one made, and then it was put on, and that one has been fine, other than the fact that it's come out 2 or 3 times. We don't remember how many times it's been at this point. So anyways, a few days ago, and I can tell when it's shifting, like when the cement is gonna let go. And so I knew for a couple days it was getting squirrely, and then I was eating something chewy like a Starburst or a Dot or something like that, and the whole thing came out. So my crown is this one. And so I put it in a baggie until I could get to the dentist, which was today, and they cemented it all back on for me. They do a really good job. I love them. Okay, now, so I go into pain management, I fill out my body pain list, and then I get called into the back, normal vitals, blah, blah, blah. And especially with new appointments like that, I always go in with lists of questions, and not even, oh man, my head hurts. Not even just lists of questions, but also lists of information that I need them to have. You know, you get that all-encompassing, what is your pain level today? So if you're asking me about my migraine, I'm at a 12. If you're asking me about my joint pain, I'm probably about a 9, because I've already put my left hip back in, 2 of my ribs this morning. My fingers keep going out because I'm typing so much at work. I've got a UTI brewing, so that's a good 7. And so that just, and you're going to try to talk about all the things. I'm never going to remember all the things. I have too much going on and whatnot, so I write it all down. So I go into the appointment, and I thankfully had my attitude right. So even if the doctor is going to be a poop, I'm not going to let it mess with my juju. So we I say we like anybody was with me. It was just me. Me, myself, and me. I'm gonna make another video of all the stuff that I have to use, but I'm not doing it tonight because my multitasking button is broken, I think. The doctor comes in and he introduces himself. He has good eye contact. He shakes my hand, which apparently is like super rare in the doctor world these days. And I introduced myself, and so he was like, okay, so like, what are you in for today? So we covered all of the side effect problems first because they're so debilitating. Oh my God, I feel like my hip's gonna go out again. It's an awful feeling. Ouch. Did you guys hear that? I hope you did. That was my hip. Feels better now. So we talk about all the side effects, which I turned too far, and so I set them off. Man, you touch one thing and it's like dominoes, right? Okay, so we covered all the side effects. He did some testing like on reflexes and stuff in my arms. Never explained anything that was going on, which I thought was a little bit weird, but I'd had it before through neurology. So we covered how long the side effects have been there, how bad they are, that they're not getting any better, that everybody else I talked to said the longest anyone else has dealt with this that I can find, and that's going through blogs and vlogs and website after website, and oh my goodness, was 7 days. I am now at like 94. God, that's awful. Oh my gosh, it's just so frustrating. Okay, so we covered all that, and then we covered my chronic stuff. All the subluxations, so all of my joints hurt. I had a list of the ones that are the worst. Migraines, muscle problems, especially if I'm dehydrated, which all of that and my thighs kicked in today, which is not great because that's normally one of my signs that I'm about to get really dehydrated. And it's not like I can just guzzle a gallon of water and feel better because my system can't handle it. And he asked me about a couple kinds of medications. Oh my gosh. He had to spell the first one for me, which was Cymbalta. Oh, I just feel like my hip's gonna go out again. Good gracious. Lordy. So Cymbalta, which I'd never had before. I'd tried several other like pain relief meds that aren't like narcotics, but they're supposed to help like with kind of systemic pain stuff. Anything that I had tried in the past either kills my stomach, which is a no-go, or makes me so drowsy I can't function, which is again a no. Like I have to be able to function. I have to be able to drive. I have to be able to work. I mean, it's just like, that's it, you know, I have to be able to do these things. So he talked about Cymbalta, and he's like, well, it was created to be an antidepressant. I just want to roll my eyes every time they say that stuff, because it totally makes you feel like, oh great, you're somebody else that thinks it's in my head that I need to be, you know, an antidepressant or anti-anxiety and whatever, and it's so frustrating. And he said it also helps with diabetic nerve pain, which I thought was interesting, specifically postherpetic neuralgia, which I'll link in the description box, or maybe one of those eyes up there that I swear to goodness I keep trying to get to work. And then there was something else, and then it said like generalized pain, myalgia, polyarthralgia, and then fibromyalgia. So we talked about it, and he was like, you know, are you willing to try something? And I was like, if it's not an opioid, I'm willing to try it. What are the side effects? And so I get the same disclaimer I always get, you know, everybody is different, you know, you never know, blah, 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 blah. And so of course, so he tells me, you know, the normal stuff, you know, nausea, vomiting, constipation, diarrhea, blah, blah, blah. Could make you drowsy, he said, could make you dizzy, he said. I really don't need any help with any of that. And I tend to have whatever GI side effect it says, I'm gonna have some of them. So I always get super nervous starting medication. So, okay, so that one is Cymbalta. And so I'm gonna start taking that one in the mornings. And then he was like, how do you sleep? And I literally busted out laughing, because he didn't say exactly how did you sleep. He said, well, you sleep okay, right? So yeah, so I slowly started laughing, and he was like, not a good sleeper. And so we went, you know, I told him all the things, and you know, I haven't slept well in more than 3 years now. And he was like, well, why, you know, what's bad about your sleep? And oh my gosh, it was crazy. So I gave him the whole list, and he was like, well, there's another medication called gabapentin. I'm not certain which one it is. I'll list it here so you guys know which one it is. And he goes, this one is made for seizures. And I'm just like, oh my Lord. I was like, that's scary. And I've been on one anti-seizure before. I think it was a GI something that we were trying. Obviously it didn't go well because I'm not on it still. And could have been migraines now that I think about it. So anyways, and so I was like, okay, side effects. And he was like, it's supposed to make you incredibly drowsy. And I was like, so sleep? And he was like, exactly. And he was like, so that one, you know, are you willing to try that one too? And I told him, and I said, you know, I can't start 2 medications at the same time, new medications, because I have to be able to figure out what, if I have side effects, what it's coming from. And so I think I'm gonna start the Cymbalta tomorrow morning and see how it goes. So I normally go 2 weeks or so between starting new medications. So yeah, super nervous. So we're talking about all the things, and he was like, what would you think about me putting you into the pain management program? And I'm like, am I not already in the pain management program? Like, you know, what is this compared to that? And he said the other one, he's like, the best way that I can describe it is it's more of like a holistic type approach as opposed to like medication. And I was like, dude, I was like, I'm all over whatever combo platter is gonna get me the most relief as possible. And I said, I'm hesitant to add any more medication into my already extensive list of medications, because it's so hard on my GI tract. It's just one more thing it's having to process. And with how much I'm having to drain my stomach so my side effects aren't as bad, you know I'm losing some of my meds from the drain. I know some of them just aren't absorbing at all because everything is so complicated for my GI tract. And so I was like, can you give me an example of what you talk about, like homeopathic or whatnot? And he was like, massages, physical therapy, what was the other one? Physical therapy, acupuncture. And I was like biofeedback, and he was like, yeah, you know, there's some like cognitive behavioral therapy that they can try. And I've always been incredibly attuned to my body, like more so than I actually would probably enjoy. Oh, man. And so I said, yeah, I said, you know, I'm extremely willing to try anything and everything, because I don't know what is going to really give me any kind of relief. And I said, repeatable relief is what I need. And I was like, you know, because I can get relief for like an hour. I can get relief for part of a day sometimes. Sometimes in the, you know, nighttime or whatnot, I can get some relief, you know, depending upon how much ibuprofen and whatnot that I get in my system. And so I was like, yeah, you know, absolutely. And so he was like, well, he's like, I've already sent the meds, you know, to your pharmacy. And let me get the referrals put together for the pain management program. And he said, you know, my nurse will be back in, give you all your, you know, good stuff, whatever. And so she comes back in literally in like 2 seconds. Like, she did so good. And she was like, here are your 3 referrals. And I'm thinking, 3 referrals? I was like, why do I need 3? And she said there's like 3 sections to the program. And so I'm referred to all 3 of them, and it's under one umbrella program, but it's split into 3 categories. I was like, okay. And she said, so they'll contact you with, let me see if I can scooch you, and you can actually see what I'm doing. Yes, you can. I'm going to flush my tube. And so she said, so they'll contact you and, you know, schedule your first appointment and go from there on, you know, figuring out a treatment plan and all that good stuff. So that was only 20 cc's, and it makes me nauseous, and it makes the cramping start. This process has not been easy. And so she said, so, you know, they're supposed to call you, blah, blah, blah. And so if they don't, I put the number on the piece of paper, and so you can call them and get everything started and whatnot. So I laughed. I thought it was very funny. And then, you know what else I have to do? I have to fix my toe. I have been dealing with a big toe infection on my left side. Well, my left big toe. And it gets infected right on the side. I'm having a very hard time getting this one taken care of. Okay, so I'm done there. I get signed out or checked out, and I asked her, and I was like, the chick at the reception area, and I was like, am I supposed to make a follow-up? You know, especially starting new meds and all that stuff. And she was like, well, normally he'll, you know, let us know if there needs to be a follow-up. And she goes, but you're being put into the pain program. And so she said it's all coordinated through that. Like, he's my official physician for it. And, you know, once they get everything kind of settled, and, you know, he goes over the plan to make sure that he thinks it's doable, right for me. If I've got any questions, I go to him with them, as well as the other providers that I'll be working with through the program. And so then I had to go upstairs to the lab to have more UTI testing done, because that's fun. And left there, and the parking garage that I was in this, for that facility, it was so easy. Like, oh, it made it so much nicer because I was already so tired. And then, so I get back to my vehicle, and I'm just like glancing through the referrals, is what I was looking for, because I just wanted to kind of know, like, what are the 3 programs and all that. And so I'm looking through it, and the first one is psychiatry, and all I can think is, are you shitting me? Like, it just, it rubbed me the wrong way as soon as I read it. So, very frustrated. Not a real good place to start. And my poor toe has so much troubles. And now it's bleeding, because bleeding. And I haven't even got the infection-y part, which is even worse. Man, that's annoying. Hydrogen peroxide to the rescue. Okay, so psychiatry, it was listed as a dual thing. Psychiatry and psychology. Oh, man, my toe hurts so bad. And you know what I keep doing because I have an owie toe? I keep kicking it over and over. I think I kicked it at work like 4 times today. Oh my God, it was so awful. Goodness gracious. Normally it doesn't go this bad. Okay, psychology, psychiatry, psychology. Then there's physical therapy, and then there's cognitive behavioral therapy, biofeedback, some of that kind of stuff. And so I got a printout of papers that they had for me, that kind of like explains the program and how it works, and how, like, what the order, like what the process is. And so, why don't y'all take a guess what the first step is? Before you can even really enter the program, what is the first step? You got it, kids. You have to talk to a psychiatrist or a psychologist, part of the program, so you can talk about your feelings. I am all for counseling and mental health, and anything and everything that is at your disposal to use to feel better mentally, emotionally, spiritually, and physically. But that doesn't mean that absolutely everybody needs that. And with somebody like me, like anything that has a chronic illness and, you know, has had to deal with this forever, the first thing that you think when anybody suggests you go see a psychiatrist, psychologist, whatever, is, oh, it's all in your head, So let's talk about it so we can convince you it's all in your head and how many more antidepressants and anti-anxiety, this and that we're going to put you on. So that puts me on guard immediately. I don't trust the process. I already have a negative attitude towards it, which hopefully between now and when I actually meet these people, I will have mostly under control. And they even put in there, you know, this isn't about, you know, trying to convince you that it's all in your head. You know, we know that it's not all in your head. And they had some valid points, like you used to be able to do, you know, run a half marathon, and now you can hardly walk across your living room carpet without needing a break. You know, you used to be able to work full time, now you're working a couple days a week from home. You know, all of this can affect your relationships and how you have self-worth and self-confidence, and they want to see where you're at so they can kind of gauge on how to help everything. Sounds great. Like, it sounds like the party line is super good. But yeah, like, to me, it still just feels like pet, you know. Oh, we know you have, we know you're hurting, you know, and I'm gonna rub your back and let's have quiet time. Oh, yeah, I really have attitude about it. I don't know how this is gonna go. So anyways, they have not called yet, so I haven't scheduled the first appointment yet. And I'm wondering how long it's gonna take me to get into even the first appointment for the program. And I think I have to meet psychologist first, and then that person and my main physician have to meet, I think, and figure out what the plan of attack is going to be and who else I need to meet and, you know, work with and find my warm center and blah, blah, blah. I need a Band-Aid. What's better than My Little Pony Band-Aids? I've got all sorts of stuff in here, actually. Okay, so that was me trying not to be judgy. I don't think it looked very well. But you know what else I've got in here? I have troll Band-Aids in here. And Aggie Band-Aids in here. I like the look of that one, even though I don't know what it is yet. You guys will find out with me. Okay. I'm wondering if other pain management programs are like this. And I'll deal, it was trolls. So cute. Yeah, I really wonder if like other programs, hey, hi, I'm right here. Focus on me. Hello. There we go. But I like the idea of other options that aren't medication. I will cross my fingers that it all works. And I will take you guys on my awesome adventures. Sometimes not so awesome. Sometimes super duper awesome. Okay, now I have a Band-Aid. So that is all I know for right now. I'm sure I've got other stuff, and I'll fill you in on another video. So subscribe below and give us a like, comment, tell me all your things. Thanks for everything. Bye.